All right. Hello, Candice here. We're doing our creation catalyst call. This was a request that we had from the community to do a topic around creating your naturopathic first aid kit. So, having that sense of preparedness, knowing what to do in more acute situations where you might not have time to, say, seek out the help of a naturopathic doctor. So before we get into the actual content, let me check in. Are there any questions, anything that I can kind of help people with coaching wise before we get going?
No.
You're all good?
Mm-hmm.
All right. I'll jump right into the content then. Feel free to raise your hand or put a question in the chat box. I'm going to mute. I'm going to mute the participants right now. And then at the end, I'll open it up again for questions. Okay. So this is a guidebook that I'll be sharing inside the community. I'll upload this to the Creation Codex, so our classroom inside the Health Creators Collective. I consider this a living document, which is the reason that I did it as a Google Doc, meaning that, there's other requests that we have, other conditions or concerns that maybe aren't included in the guidebook as of today. We can always add to that or modify. So the way that I approached it was putting together a list of concerns and how to address them that I see as being the most common ones that people run into, and what would be required to make up like a foundational, really strong first aid kit for yourself without any overwhelm. Because there's so many remedies. When I went through naturopathic school, we had hundreds of remedies for like each condition that could be used and had to figure out that differential. Um, Obviously, when you're in a situation that's more acute or urgent, you don't want to have to think about all that. So the goal with this guidebook is it gives you like do this and then do this. So it's really simple, straightforward, and to provide the context. I have over 17 years of clinical experience as a naturopathic physician and functional medicine doctor. In addition, I'm a mother too. So just personally, I've needed to put together a natural first aid kit for myself and my family. And so just know that these remedies are tried and tested. So I've been using these for years and years, both with clients and personally for myself and my family. And, like I said earlier, I get it. It's nice to have the peace of mind that you're prepared for what's ever going to come up. So that's the um, one of the goals or intentions for the first aid kit is to support you in that self-empowerment. So there's kind of three key sections to the workshop and the guidebook. The first is like what are the contents, actual contents of a basic naturopathic first aid kit. So you can literally check those off and put together your kit. I actually have an option for you to purchase. It's all done for you. Everything is in there already. Or you could put it, source the items out yourself separately, say from your local health food store or pharmacy. And then we'll look at each remedy that's included in the kit, what its use is, what its benefits are, how to dose it, how to use it, and then specific conditions, like minor first aid conditions that come up, and how to address each of those in turn. So, the other big intention of this workshop and putting this guidebook together for you is to ease the pain of minor conditions, so things that you can treat on your own at home, and to do it in a way that enables the body to heal itself. So we're not suppressing symptoms, we're supporting the body's own natural healing ability. Okay, and an important note, I put this at the beginning, hopefully it goes without saying, this is meant to treat minor first aid conditions. and to be a complement to, the typical first aid training you would receive through places like the Red Cross or St. John's Ambulance. So I'm going to do my best in the guidebook to help you distinguish the more serious concerns from the minor ones that you can treat at home. But no, like if it is serious or if you're in doubt whatsoever, then, just seek out the help of a medical professional, head to the emergency room or call 911. So just to be very clear, we are not treating serious conditions. These would be the ones that would be deemed more serious. Any serious injury from a fall, if there's a blow to the head, just err on the side of caution, seek medical treatment. And any more severe blows to the chest or abdomen, any part of the body where there could be the risk of internal bleeding, we're not treating that. Any excessive bleeding, that's, not stopping with pressure and compression. Any change in behavior or consciousness, symptoms of shock, second or third degree burns. So always, always seek out medical attention for those. Hopefully that's just obvious common sense stuff. And then, afterwards, for the aftercare, you can utilize a lot of these remedies, seek out the support from a naturopathic doctor or holistic healthcare provider for aftercare support after the emergency care has been implemented. Okay, so the basic naturopathic first aid kit, this will treat essentially 98% of the most common concerns in a really effective way. So the first part are things that you would find in your typical first aid kit. So ones that you can get from the Red Cross, St. John's Ambulance, you could purchase from your local pharmacy. So I'm not going to go through those. Hopefully those are pretty straightforward. You know how to use all that. For antiseptic treatment, so to clean wounds, I love using St. John's wort tincture. I find it's really effective. So that's included in the kit that I've put together for you. Calendula tincture and tea tree oil are really great too. Tea tree oil, you do have to consider diluting it in certain cases. It's not one that you would necessarily apply directly to an open wound. And then for the calendula tincture, it's often used when the wound isn't especially deep, but I'll kind of go over that again when we get to the section around like abrasions and scrapes. But I kind of put them in the order that I would use them or reach out. Like I would probably go with the St. John's wort tincture first, or if you're not sure which one, just grab the St. John's wort tincture for antiseptic, like applying to a wound to clean it. To promote tissue healing, so after you've cleaned the wound, calendula is really great, either the botanical cream or the homeopathic cream. Now, to differentiate between the two, the botanical cream is also going to have antiseptic properties to it. So it's similar to the tinctures, just in cream form. So it's the herbal extract that's being used in that substance. The homeopathic cream still has the tissue healing properties, but doesn't have the antiseptic properties to it. Okay, so you wouldn't use the homeopathic cream for cleaning the wound. You could use the botanical cream for both properties, for wound cleaning and to support tissue healing. Vitamin E oil is also a good go-to. Like I said, I kind of put them in the order that I would reach for them. So I like calendula for this purpose of tissue healing. For bruising, arnica is my go-to. So whenever you see like 30C here and pellets, this is referring to homeopathic remedies. So homeopathic remedies, I love using them, especially for first aid or more urgent concerns, because there's no risk. There's no adverse effects. If the remedy isn't a good match, nothing's going to happen. So worst case scenario is you're not going to, notice any benefit from it, but you're not going to run the risk of like worsening the situation or causing any harm. So to me, they're kind of no-brainers. And if you use it in this lower dose, the 30C potency, so 30C is specific for physical conditions. There's really, you can't go wrong. And I'll go over more about like how to use the homeopathics, how to dose them as we get into the specific conditions. Witch hazel distillate is great. So you can get like witch hazel tincture or distillate, which just means that it's been steam evaporated. It's a little bit more concentrated, the distillate form, but either work well. And then there's arnica in a homeopathic cream version that it could be applied topically to heal with bruising. Burns, we have a few options here. Topically, the go-to is often aloe vera gel. So if you have like an aloe vera plant at home, just open the leaf and use the inside, the pulp on the inside of the leaf. That works, what I found, like better than anything. Urtica urens, either the homeopathic ointment, so you can get in ointment form, or just taking the pellets, dosing those orally works really nicely. So Cantharis or Urtica urens are the homeopathic options for burns. Nerve pain, hypericum, which is the homeopathic version of St. John's wort, and then fear and upset, any emotional distress. Rescue remedy, which is a Bach flower combination, or the homeopathic remedy aconite. So, like I said, I'll go into each of these in more detail, but like there's your basic naturopathic first aid kit. So if you were to look at that list and kind of check out all those, put those in your kit along with kind of like the typical bandages, gauze, etc., you're good to go. That will treat, like I said, 98% of the concerns right there. All right. And then what I did too was I added some like add-ons. So if you wanted to customize your kit, you could consider those. So in like specific situations, like morning sickness, or motion sickness rather, like ginger works really well. Hey Melissa, I'm just gonna mute you. So there's like no background noise. But if you have any questions as they're going through, feel free to raise your hand or put the question in the chat box. Okay.
Okay.
All right, so we just got started. I went through like the basic content. So if you wanted to create like your naturopathic first aid kit, what are the basic contents that you would put in there? Yeah, Deanna, if you have a question, feel free to unmute yourself. You can ask that.
Candace, I'm just going to get off of this call in about 10 minutes or so I can run home and eat lunch before our next appointment.
Oh yeah, no problem.
Okay, thank you.
Yeah. You'll be able to access the recording.
Yes, thank you.
Okay, you're welcome. All right. Yeah, so Melissa, you'll have access to this handout. It'll be put in the classroom afterwards. And I made it a Google Doc, so it's a living document. We can always add to it if needed as we go along. But as I was saying, like if you were to use these contents to create your naturopathic first aid kit, it would address pretty much like 98% of the most common concerns that pop up. So it's a really strong foundation. I'll give you an option at the end that I've put together. Like it's all made for you. You can access it through FullScript, the online dispensary, or you could just source these items, from your local health food store too. Okay, so we'll go through like the kits themselves, and then I'll go through the remedies, how to use those, and then we can look at some specific concerns. But yeah, in addition to the basic first aid kit, I put down some remedies if you want to get a little bit more specific. Like for example, you're going to be traveling. Good idea to add these remedies for traveling purposes. Prevention of travelers, diarrhea, constipation. If you're going to be camping or spending a lot of time outdoors, there's remedies specific for those circumstances as well. Okay, so you can consider those add-ons to that foundational or basic kit. All right, so then the next section are the remedies mentioned in the kits, and I've divided it into herbs, essential oils, and then the homeopathic remedies. So with each one, you have a description of the medicine, and then the dosing that would be used. And if there's a caution, like if you need to be aware about something, I've included that as well. So I'll go through each of these like really quickly. There's a lot of them, so I'm not going to spend too much time. Aloe vera gel, mostly we'll use that for burns, sunburns, first degree burns, anything, that requires some soothing or cooling. Um, if you have an aloe vera plant, like I said earlier, great to just open up the leaf and use the pulp inside, but you could purchase the aloe vera gel as well. Arnica is probably going to be your most used remedy. It just has a lot of different applications. It's excellent both at the physical level and kind of the mental, emotional level. Sometimes there's going to be shock or upset, emotional upset in cases of like urgent or acute care situations. So Arnica is a really good go-to for that. So you'll see this one in herbal form and then also the homeopathic. In herbal form, it's usually going to be just the topical, or if you have the tincture, you can add it to water and then pour it onto a towel and apply it topically, like to a bruised area or injured area that way. Calendula, same idea. You can use that in the herbal form and or the homeopathic form. So as I mentioned earlier, the thing with calendula to be aware of is that you don't use it on deep wounds. Okay, so the reason for that, it's really effective at healing skin. So it would heal the top layer before the bottom layers have fully healed, and you don't want that to happen. So don't use that for like severe lacerations, puncture wounds, these deeper type wounds. You probably should be seeking medical attention for those anyway. So calendula in the use of minor conditions like we're talking about will be just fine. Grapefruit seed extract is an antibacterial. So most often it's going to be used to treat diarrhea or prevent traveler's diarrhea. That's kind of a great option to bring while you're traveling. Fennel seed, typically you'll use the seeds in tea format. So if you have a tincture, you can use that too. But most commonly, it'll just be the seeds or the tea, like you already have the tea purchased. Really great to combine with peppermint for diarrhea and replenishing the body, like rehydrating the body. Ginger, so the crystallized form, you could find it like as chews, for example, or lozenges. Really great for nausea, vomiting, motion sickness. The one caution with ginger is you wouldn't take it if you have a stomach ulcer, just in case there's further irritation in that case. Peppermint, I mentioned you can take it along with the fennel for the purpose of diarrhea. It's great for colic in babies, nausea. So it's antispasmodic. It'll help prevent vomiting. It promotes sweating too, so it's great, for fevers. And the one contraindication here is you wouldn't use it if you have a hiatal hernia. Okay, it's more theoretical contraindication, but we're erring on the side of caution. St. John's wort, as I mentioned, it's my recommended go-to for a topical antiseptic. So I like keeping the tincture on hand for that purpose. Great for cleaning wounds. So you just apply 10 drops to a cup of water and then, soak a piece of gauze in that and apply it topically. Witch hazel, you can use the tincture or the distillate form. Those are going to be most commonly found at the health food store. It's similar to the St. John's wort. You would just soak that in, the gauze pad and apply that topically. So with the distillate, you could do it directly. With the tincture, you would dilute it similar to the St. John's tincture. With essential oils, just note of course, these are only used externally. Don't take these orally or internally. And most of them you're going to want to dilute in a carrier oil. So good options: olive oil, grapeseed oil, almond oil, and a good ratio is like 2 to 3 drops of the essential oil to a teaspoon of the carrier oil. Okay, so there's a handful here that I kind of pulled out. Citronella is great for repelling insects. So as an insect deterrent, that's probably its most common use. You can put 5 drops in like a 2-ounce spray bottle, or 5 drops in a 1 ounce of carrier oil, and just apply that directly to the skin. And you want to reapply it every 20 minutes if you're outside for a longer period of time. So this one, again, do not take that internally. Keep away from the eyes, especially because it can irritate the eyes. Tea tree oil can serve a number of purposes. It's got antibacterial, antifungal properties, antiseptic, so it can be applied to wounds as well. So great for like minor cuts, scrapes, any fungal issues on the skin. And then vitamin E oil, very similar, more for like wound healing, tissue healing. And with any of these, you're not going to apply anything topically in the case of 2nd or 3rd degree burns. Okay, homeopathic remedies. As I said at the beginning, I love homeopathic remedies for any acute, more urgent issues. Often they'll have expiration dates on the labels, but you can disregard that. Homeopathic remedies last for a lifetime, so they don't actually ever expire. So they're really cost-effective options to have in a first aid kit. You don't have to worry about restocking them or like replenishing them. They're never going to expire. So to dose homeopathic remedies, and this applies for any of the ones that I've listed here, a dose is 2 pellets dissolved under the tongue. And typically you'll dose it fairly frequently in acute cases. So every 5 minutes, every 15 minutes, every hour. I listed the frequency for the conditions. And once there is improvement noted, then you pause or you stop the remedy. You don't need to continue dosing it. So once you notice improvement, then you can stop it. It's had its action. You just want to let it do its thing, so to speak. Now, oftentimes there can be what's called an aggravation with homeopathic remedies. So the symptoms, especially in the beginning, will get worse for a temporary period of time, and then you'll notice an improvement after a few to 15 minutes. That happens quite often in the case of acute injuries. So just know that that's part of the healing process. It's actually a good thing. And so it just means that you selected the right remedy, and it's, again, doing its thing. Repetition is not necessary in that case. If it continues to improve, like you said, you don't need to repeat it. You should only repeat it if there's a plateau, like there's not a continuation of the symptoms improving over a relatively short period of time. So in terms of the specific remedies, aconite is great for any mental shock and fear. So emotional upset, anxiety, restlessness, immediately following an injury. There's some other what are called keynotes to them. So you could check that out. Like, you may not always see like the person is worse after exposure to cold, dry wind. So if you still have that like mental shock and fear, you can still use aconite. So these other additional keynotes, they're not necessary, but what they can sometimes do is just help you to differentiate between a couple of remedies. Like if you're considering aconite or arsenicum, for example, because arsenicum could be used for anxiety too. But if you happen to notice that, the symptoms are worse between this time, maybe you would reach for arsenicum over aconite. But like I said earlier, with homeopathic remedies, if it's not a match, nothing's going to happen. There's no worsening that's going to happen. So if you only have aconite on hand in that example, use aconite. You really can't go wrong. Apis is especially great for bee stings, insect stings. Yeah, that's going to be the main one for that. Just a note, you don't want to take a dose lower than 30C if you're pregnant. Um, that's for risk of just allergic reactions. Um, but anything 30C and above is fine. With this acute care, like first aid application, all of the remedies that I listed would be used at 30C. That's kind of the go-to dose because you're having the impact at the physical level. We're not, really messing too much with like the energetic level. It's more at the physical level. Arnica is your go-to for any trauma. I would just, have arnica on hand all the time. It's really great for like mental shock after the injury as well, and then anything related to like physical trauma to the body. Yeah, Melissa, feel free to unmute yourself and ask.
Okay. Just curious. So sorry, when it says worse, so under arnica, continued movement, slight pressure, heat, does that mean like what you're feeling gets worse during those?
Yeah, you got it.
That means that arnica would be suitable for that?
Yep.
Or not? Yeah.
Yes.
Okay.
Yes. Yeah. So in the case of arnica, often the symptoms, so say, for example, the pain due to the bruising might be worse if the person is continuing to move that part of the body.
Okay.
And that means, that arnica is especially indicated for that.
Okay. And what is the better part? It's still indicate what's the difference between it's still indicated if you're starting to move and it feels better?
Yeah, they're what are called keynotes. So it's like with arnica, the person may notice that the symptoms are better when they just start to move, but then they worsen after continuous movement.
Gotcha.
Right.
Okay.
It's just like qualities or characteristics that you might see that make the symptoms better or worse.
Okay.
Yeah.
All right. Thank you.
Yeah. So anything that feels bruised, beaten up. So I would just like use arnica almost automatically. You'll see when we get to the conditions, it comes up again and again. Arsenicum is great for any fear, anxiety, nervousness. Fear of death is a big one too. Like if someone has a fear of flying when they're traveling, and that's because, it's because of that fear of death, arsenicum is really indicated for that. And then diarrhea from specifically from food poisoning, but you can use it for most cases of diarrhea with good effect too. Belladonna is one, whenever the symptoms come on suddenly, like it feels like all of a sudden, a lot of throbbing, that's a keynote for belladonna, throbbing, lots of pressure. So we generally use it for like heat exhaustion or heat stroke. Now, in those cases, you want to seek medical attention anyway. By the time you're in those states, there's the risk of loss of consciousness, but you can apply the homeopathic remedy and then, seek out medical attention. But a keynote like with belladonna is throbbing headache. Like sudden nosebleeds, anything that's sudden that feels like it came on all of a sudden. Bryonia is great for sprains and strains. Heat exhaustion or heat stroke is another reason to use belladonna. Calendula we talked about, like for cuts and abrasions. Usually you're going to be using the topical, either the calendula salve, ointment, cream for tissue healing. You can use the homeopathic. I find that it's going to have a little bit slower effect though in that case. Cantharis is great for burns, sunburns. It's going to be its main focus. Cocculus for motion sickness, vertigo, seasickness, morning sickness in the case of pregnancy as well. That's going to be its major use. Gelsemium is fear. So it's like an anticipatory fear. is its keynote. So fear of any upcoming event, fear of, having to speak in public, having to fly, and then you have all the symptoms that can come when you're in that nervous state. Trembling, fatigue, diarrhea, etc. But it's a great one for jet lag as well. So fear of flying, and so again here, like it's an example of differentiating between the remedies. Arsenicum would be like fear of flying in the case the person's afraid of dying, whereas gelsemium is just that fear of upcoming flying, and it's more they're not sure exactly what the source of the fear is. Hypericum is great for any nerve-related pain, nerve-related injury. So nervous tissues, if you've banged your finger and there's that, sharp piercing pain, or stubbed your toe, anything involving nerves, tailbone injury. Once you've dosed arnica, dose hypericum. Any concerns related to tooth pain, anywhere in our body where we have a lot of nerve endings or nerve roots. Hypericum, which is the homeopathic version of St. John's wort, is indicated. Kali muriaticum. So I've included this in the kit that I've given you as an example. This is the tissue salt, so it's not a 30C dose. This one's the exception. It's called 6X is the potency. And the main indication for this one is ear infections. So like if the eustachian tube is blocked, any fluid in the ear, any congestion in the sinuses, the throat, the ears, it's kind of its major concern there. Ledum would be for puncture wounds. So think insect bites, stings, any part of the body that feels cold or numb as a result of the injury. And then it's also indicated for injury to the eye, like in the case of a black eye. Natrum muriaticum, in acute situations, it's going to be mostly diarrhea. Also head blows. So if you have a headache, that's due to a hit to the head. And we're talking like minor situations here. Obviously, if there's a concussion or a serious head blow, you want to seek medical treatment for that. With Natrum muriaticum, you'll also see a lot of the mental emotional picture. So the person will be down, like their mood will be low, they're very irritable, their tolerance level is low, so kind of like easily offended. Nux vomica is excellent for any nausea, vomiting, motion sickness. I don't have it here, but the go-to remedy for a hangover. Oh, no, I do have it here. Resafter alcohol. So yeah, in the case of a hangover, Nux vomica is a good go-to. And in this case, the person generally is like really sensitive to noise and odors. They're just like overly sensitive overall. Phosphorus is going to be mostly used for nosebleeds. A nosebleed where it may be difficult to stop it, just with the regular pressure that you would apply to a nosebleed. Pulsatilla, in acute cases, you're going to use it mostly for earaches. It's a great constitutional remedy, but for that, you probably want to seek out the help of a naturopathic doctor to make sure that you have a good fit. But for acute cases, yeah, earaches is the go-to. Earaches, like in airplanes too, like if you have a lot of popping in your ears, that's painful. Pulsatilla is good to have on hand for that purpose. Restox, sprains and strains. So whenever you have injury to a joint, it's going to be your go-to. So just dose that immediately after injury. And it's also great for the relief of poison ivy, poison oak, where you have the itchiness and irritation to the skin. So Restox, think poison ivy, sprains and strains. Ruta is for sprains and strains as well. It's more if you know like there's specific injury to cartilage or tendons, which sometimes you're not going to know. So Ruta, I would see most often used like in the case of athletes where they know like they've pulled a tendon or a ligament has been injured. If you're not sure, just go with Russ Talks. For sprains and strains, you're gonna cover your base anyway. Ruta graveolens is great for like post care. So once you've gotten over that initial acute stage, you can use the Ruta graveolens to support healing. Symphytum is great for fractures and bone healing. So if you've broken a bone, you could take Symphytum to heal that healing, to quicken that healing process. It's also indicated for any injury to the eye as well. So this would be more like blunt trauma, whereas the ledum would be like more of a sharp injury to the eye. Tobacco, this is the homeopathic version of tobacco. So it's great for motion sickness, nausea, vomiting, and one of the keynotes here is you're sensitive to tobacco smoke. And then the last one is Urtica urens. And this one is especially indicated with insect bites and first-degree burns. Okay. All right. And then we'll get into specific concerns. Any questions about that section though, like around the remedies themselves?
Myself. Just curious, I think I just came in when you were talking about, or maybe not, sorry, the storage, and you said they don't go bad. So do you store them just in dark, like a dark bed, like in a dark closet, or does it not really
For the
matter?
homeopathic remedies, they'll have an expiration date just because that's required for like Health Canada purposes on the label, but they never expire. So as long as they're stored in a cool, dark place, you're good.
Okay.
Yeah, and if you have them like in a first aid bag or kit, that's gonna be the case. As long as they're not in like direct heat, they can last for forever.
Okay. All right.
Yep. Okay, and so with the specific concerns, how I outline these is I put like step 1, step 2. So 1 is primary treatment, I do this first, and then 2 is secondary treatment, do this next or second. And so I tried to simplify this as much as I could. So, when you're in an acute situation, you're not going to want to have to think too much or worry too much about like, what do I do? So to prevent confusion and overwhelm, you just have like step 1, step 2, do this, really simple. And again, you could see all the different concerns on the side. You can click through these in the document. So you can, go directly to insect bites, for example. And then, there's also the search function as well. So Control F on a Mac. And then if you wanted to search for, specifically like earache, it would take you to that section of the document, right? That's all about earaches. So the table of contents here on the sidebar comes in handy for that purpose. Again, just reiterating, seek out medical care, obviously, if it's not a minor condition, if it's more serious. And I didn't include like aftercare pieces. So like for ongoing care, aftercare after kind of the acute situation, seek out the support of a naturopathic doctor. Then you can, get prescription for like vitamins, minerals, for example, that might be applicable and just helping to support the healing process after that acute stage. So the first one, bruising, a serious situation here would be a blow to the head or a severe blow to the body where there's risk of internal bleeding. Hopefully obvious, seek out medical attention in those cases. Any potential injury to head or spine, just, don't move the person, wait till medical help arrives. But for a minor situation where just, part of the body has been banged or bumped, cold water compress first, dose arnica 30C, so 2 pellets dissolved into the tongue, every 30 to 60 minutes for up to 4 doses. Yeah, in the majority of cases, that's going to do it. You're not going to do anything more than that. You could apply arnica cream or Traumule, which is very similar to arnica cream. It's just like a brand version of that, topically to the area that's been bruised. With burns, and this includes sunburns, so we're treating minor first-degree burns where the skin is pink to reddish. It can feel hot to touch. There may be slight swelling. It can feel dry, but you're not treating second or third-degree burns. In the case of those, you can still dose the homeopathic remedies that are listed here. Dose them on the way to seeking medical treatment, though. Okay, so if there's blistering, especially if the blisters are open, if there's any secondary symptoms like fever, nausea, chills, if the burn is bigger than the size of your palm, if it's interfering with breathing, if it's at a skin bend, which makes it a lot more difficult to heal, if it's electrical or chemical in nature, or if the burn, has been inflicted on someone really young or an elderly person. Okay, so cold water first for a first-degree burn, arnica, and then aloe vera gel topically to soothe any irritation. And then you could use either urtica or cantharis. So whatever one you have on hand, you can go back to those sections of the remedies to see which one is going to be a better match too in terms of their keynote symptoms. So you dose those every 10 minutes or until the pain subsides. And remember, in the case of these homeopathic remedies, as soon as you notice improvement, you can discontinue them. Okay, so like I said, the homeopathic remedies could still be used. You could still take them in the case of any more serious burns. You do not apply anything topically to second or third degree burns. And in all those cases, you seek out medical attention. For constipation, so a serious case would be anything lasting more than 5 days. Obviously, if there's bleeding in the stool or any extreme pain, abdominal pain. Acupressure is actually the primary go-to treatment for constipation. I find that it works really well. So I've given 3 acupressure points that you can do. And at the end of the document, I gave you a link to a site too, which is called Acupuncture Points Guide. So it gives you some visuals to locate the points. But CV6 or conception vessel 6 is just below the belly button. And for all the acupressure points, you would apply like a firm pressure to them for about 2 minutes. So about an inch depth pressure, and then just gently let go of the point. LI4, so LI is large intestine. It's located between the thumb and index of your finger. And if you want, I could do a demonstration of these later on too, if that's of interest to the community. But like I said, I have a link to show you where the locations are as well. And then LI11 is at the end of the elbow crease. So when you bend your elbow, it's right on the external outer side at the end of that crease. Okay, so those, if you don't remember acupressure, those points, just reach for Nux vomica. Really great in the case of constipation as well. For the opposite end of the spectrum, diarrhea, serious would be a situation that's persistent more than 48 hours, because then you're at risk of electrolyte, fluid loss, or if there's extreme abdominal pain, blood in the stool. Grapefruit seed extract is great for diarrhea, and then you can rehydrate yourself. So there's a solution, a mixture that you could do yourself at home with things that you have at home. There's lots of electrolyte mixes on the market though too that serve a similar purpose. This is where the fennel and peppermint tea comes into play. So 2 teaspoons of the crushed fennel seeds, 2 teaspoons of the dried peppermint leaves, or you could just purchase these teas already set to go. Arsenicum is the go-to remedy for the diarrhea. And how you dose it is just you dose it after every unformed stool for up to 6 hours. And again, in most situations, that'll do the trick. So for eye injury is never minor. You don't want to mess around with your eyes. So even, if it seems minor, still get it checked out. So it's one of those cases where you can definitely dose the homeopathic remedies, and we've gone over those previously. So arnica, ledum, but then, seek out an assessment from your doctor, or head to the ER. For heat exhaustion, similar situation. You can dose the homeopathic remedies, bryonia or belladonna, every 5 minutes. But heat exhaustion is not a minor condition. Like I said earlier, there's the risk of loss of consciousness. Heat stroke is when the body can no longer regulate its temperature. So in that case, you're going to see like the sweating stop. The body temperature is quickly increasing, and that's, you call 911 in that situation. For insect bites, so a serious case would be mostly if you're seeing an allergic reaction. So swelling of the throat, hives, difficulty breathing, weakness, redness that appears to be spreading, vomiting, fever, any of those, you want to get medical attention right away. And then if the bite becomes infected over time, so that might not happen immediately, so watch out for those symptoms in that case. For prevention of insect bites, we talked about citronella or tea tree oil, and then St. John's wort to use as an antiseptic, so over the bite, and then apis or ledum are great for healing the bite itself. Insect stings, similar to the bites. Obviously, you want to remove the stinger first. Place ice on the sting. You can use ammonia, baking soda, and water, any combination of those to reduce the pain. Arnica as your first go-to, and then ledum or apis. Apis is great for bee stings. For emotional upset, in a serious case, so you're going to see signs of shock, paleness with sweating, cold limbs, rapid weak pulse, cold and clammy skin, any or all of those, again, seek out medical attention. Blackfly remedy is, the rescue remedy is the easiest kind of go-to. It comes in spray format now too. So you can literally just put a couple of sprays and it tends to work very quickly. Arnica or aconite for emotional upset. And then there's specific acupressure points, again, that I've included as well. You can also use these. I find they're really great in the cases of like panic attacks. Sometimes, it takes a little bit to have a sense to do them. But like, for example, this GV26, it's like right between the upper lip and the nose. So you actually put your finger like under your upper lip and just apply that pressure towards your nose. So it's kind of an easy one to remember. Kidney 1 is right on the bottom of your foot, just right underneath the pad below your toes. You can't really go wrong by pressing firmly on that point for a minute too. So I find those really work well for panic attacks. And then nosebleeds, phosphorus is the one that's most indicated homeopathic remedy, but you can use arnica or belladonna if you have those on hand and not phosphorus. The go-to position, tilting your head forward, pinching the fleshy part of the nose. You do that for about 10 minutes. So if the bleeding is lasting beyond that, that's, would be a case of seeking out medical attention. And obviously if there's been like a blow to the head or a fall that triggered the bleeding from the nose, have that checked out. For poison ivy and poison oak, we talked about Rust Tox being the go-to remedy for that. Topically, you can apply calendula tincture or ointment. And just remember to wash the area because it actually takes about 10 minutes for the resin to sink in and trigger that effect. So if you wash it right away, or as close to exposure as you can, sometimes you can minimize the symptoms by quite a bit. And obviously, if you're having any signs of a more severe allergic reaction, seek out medical attention. For scrapes and abrasions, as I mentioned earlier, the St. John's wort tincture is the go-to antiseptic, and then applying calendula cream to support the healing of the tissue, and then arnica homeopathic is great for healing the bruising that goes along with that. So anything that's a deeper wound, laceration, puncture wound, where the skin has been torn away, seek out medical attention for those. Sprains and strains, we talked about Restox being the go-to for that. Do your typical first aid care. So wrapping ice in a damp towel. You can also soak about 10 drops of arnica tincture along with the water and place that directly over the affected area. And I recommend alternating it. So 5 minutes on, 2 minutes off. You always give the area of the body that's been injured some time to rest as well. Elevate the affected area, and then, of course, arnica homeopathic immediately. So as soon as you can after the injury. Okay, and then lastly, stocking your first aid kit. So like I said, I created an option for you. So if you click on this link, it'll take you to your online dispensary full script, all the remedies that are needed for that basic first aid kit are all there. And you can modify that, so you can add or remove remedies from your cart as you see fit. Those are professional line brands, so high quality, you know what you're getting. If you want to do it yourself, like I said, just your local health food store could probably, you can access the majority of these items from them. I gave a list of what I feel are higher quality brands to look out for. So St. Francis is great for any of the herbal remedies. And then for the homeopathics, any of these brands are great. And then if you have trouble finding, especially the homeopathic remedies in health food stores, sometimes they have difficulty ordering those in for you. I've listed a few resources for online stores that have, a wealth of homeopathic remedies at their disposal. Okay, so in Canada, Riverdale or Thompson's are great. In the States, Heinemann or Standard Homeopathic. And then the links for those acupressure points to get the locations down. They're pretty simple. And like I said, we could do, an acupressure demonstration if needed in the community, but I think it's pretty straightforward.
Mm-hmm. Okay. So just one quick question. Is this where I would go, the homeopathic remedies, is that where I would go to figure out which one to do for a headache? Because I know in the specific concerns there wasn't a headache bullet, but you've said they're kind of different to treat, right? Like they have a lot of there's a lot of different headaches. So is this
Yeah, headaches aren't considered first aid. It's not a condition that was typically considered first aid, because there could be a lot of different, triggers for the headaches. If it's just a one-off, that's one thing. But most of the time, headaches are ongoing, or it's more of a chronic condition.
Gotcha. Okay,
Yeah.
That clears it up.
Yep.
Cool. This is awesome. This is great. Mm-hmm.
Well, good.
Thank you.
Yeah, you're welcome.
Yeah.
So I'll post this, a link to the document in the classroom, the Creation Codex. And then I'll also put a comment section below. So if there are any concerns that you think of that are not included in the handout, feel free to write them there. And then, like I said, it'll be a dynamic or living document. We can add to it as we go along. But I think this covers the majority of stuff. And if you set up your first aid kit with what's included, you're good to go.
Yeah. So it's something pink eye not considered first aid? Like ear infection? Well, actually, you had something about ear infections in there. I guess I think of them differently, right? Like if headaches aren't first aid, is pink eye first aid, or is that completely separate?
Yeah, I mean, I didn't include like things like a cold or flu or pink
Yeah.
eye. That would be more like infection based.
Okay.
I
Okay.
mean, like for pink eye, you have to differentiate between viral versus bacterial versus allergic. So
Okay.
you're getting a little bit more complicated.
Yeah, that's what I mean. Like, is
Y-
it infection? Is it, I guess, not first? Yeah, that
Yeah,
explains.
yeah.
Mhm. Okay.
I mean, I can put a section for those things. So, like, if you want to write those in the comments, like those, a list a few of those, that's fine.
Okay.
What I included in this was like specific first aid.
Yeah,
Yeah.
this is great. This is great. And then, like, when I go camping, I can bring my little book
Yes.
and some remedies and
Yeah,
have
exactly.
something to treat.
Yeah. But I mean,
Yeah.
I'm happy to add those other sections in. Those tend to be a little bit more complicated because there's other things that you have to look at. But with this
Gotcha.
stuff, it's like you can just pull this remedy and take it, right?
Yeah.
It's yeah.
Yeah, that makes sense. Okay. Well, this is a fantastic start. I'm very happy about this.
Okay, cool. Yeah, so
Yeah.
hopefully that helps. You know, I
Mm,
said at the beginning to help you feel prepared and
yeah,
for whatever's gonna come. But yeah,
totally. Yeah, that's awesome.
okay, cool. Did you have any other questions before we finish up or
No,
no? Okay. Anything else coaching wise that you'd like help with?
no, I don't think
We're
so.
good.
Yeah, I sent you an email last night about vitamins. I don't know if you've had a chance to read that yet, but just a
I
little.
haven't seen it.
That's okay. I forgot to ask you yesterday when I saw you, so.
Okay. Okay. No
Yeah,
worries. Yeah.
awesome.
Okay.
Thank you, Ken.
Oh, you're
Mm,
welcome. So I'll post this, and like I said, if you have any other questions that pop up, or there's like
mm,
other conditions or concerns that you want to see added to the
mm.
document, just add those to the comments in the community.
Okay, cool.
Okay. Okay. Thanks,
Mm.
Melissa.
Oh,
Have
thanks,
a good rest of your
Candace.
day.
You
Okay.
too. Bye.
Bye.